Hello everyone, I'm Dr. Taz, here to help you on our journey to whole health. Today's topic is heart health. As many of you know, February is Heart Health Awareness Month, and we want to take a moment to think about heart disease. It is the leading cause of death in the U.S., with more than 1 out of 4 Americans suffering from some form of cardiovascular disease. It's also costing our healthcare system almost $110 billion a year. We have to do something. We need to figure this out. What can we do to prevent and think about heart disease? Well, the root of heart disease, like unfortunately many other diseases that we deal with today, is inflammation. So managing inflammation and thinking about inflammation is a first good step. How do you do that? Well, think about an anti-inflammatory diet. I've talked about it before. It holds true for heart disease as well. Really lower your sugar, lower your gluten in your dairy, and focus on a plant-based diet with lots of healthy fats. That's our first step in thinking about heart disease. The second is exercise. Exercise does a couple of different things for your heart. It increases the good cholesterol, the HDLs. It helps to lower the bad ones, the LDLs. But more importantly, probably, it helps to manage stress. And what we're learning about stress is that chronic stress, stress without relief, can lead to heart disease independent of every other factor. So you could be eating right, you could be sleeping, you could be exercising, but if you're not managing stress, you're still at risk for heart disease. So we have an anti-inflammatory diet, we have stress management, we have exercise. There are supplements that help too, and I often talk about those in practice. So for example, CoQ10, the B vitamins, we know they help manage heart disease and help to rebuild the heart. And then the omega-3s, the good fats, help to really lower cholesterol and keep your blood flowing nicely throughout your heart. So supplements will help as well. And finally, the question I probably get the most is, where does cholesterol fit into this? And people always want to know what they should do about cholesterol. Do they manage it? Do they ignore it? Well, my answer back is cholesterol is important. You want to keep it low, but the important part of cholesterol management is to understand what type of cholesterol issue you have. If you have a lot of small particles, well, that may justify medication. If you don't and you have larger particles or just high triglycerides, you may be able to manage your risk factor for heart disease through diet, exercise, and stress management. So hopefully this has been helpful. I hope that we can all work together to prevent heart disease and lower those statistics. Thanks for watching. I'm Dr. Taz on the Journey to Whole Health.